everyone, this is your host Nirmal Joy. This is an investigative report on COVID-19 for Asian College of Journalism. Without further ado, let's get to the reports. No one would ever imagine the start of 2020 that would be the world will be grappling with the pandemic by March. As governments scramble to respond to the virus has spread over 140 countries, causing tranquility in the world economy. And also it started disrupting the supply chain. The disease, which is officially known as COVID-19, was first reported on World Health Organization on the last day of 2019. Masks, thermometer, quarantine notices and travel restrictions. These are some of the tools that the government used to contain the corona pandemic. On 16th of March, the global death and infections has surpassed China. Taking into account the confirmed coronavirus cases in a global scale, United States, Italy and Spain are top in the list. We have Dylan joining from Texas, United States for the updates on the coronavirus status. Let's hear what he had to say.
Okay, so I'm a major Trump fan, not gonna lie, but uh basically he's just trying to stop the spread as much as possible.
Right.
And so he's putting everyone in quarantine so it doesn't spread as fast so the hospitals can deal with it and everything.
Right.
Yeah.
So you got your groceries and things like that back nearby or what?
Yeah, all essential businesses are staying open. So people can still get their food and stuff like that.
Right.
But all hair salons, all movie theaters and stuff like that are closed. There's no you can't have mass gatherings or stuff like that.
Do you think that precautionary measures from the government side, US government side, was pretty late on the subject matter?
Okay, I've heard about this. I do think it was a little late, but then again, they didn't have all the information on the virus.
Right. So if you want to go out, what are the formalities that you have to undergo? Do you have to fill some particular form, or you have to compulsorily wear the mask and things like that? Or
I personally don't, but then again, I'm not really worried about it because I'm 20, and they say that now it's down to around 5% death rate, and since I'm healthy, I'm just gonna feel flu symptoms and stuff like that, and I should be fine and live through it.
Right.
I don't think anyone's really guilty because everyone's been saying it for years. It's not it's not if, it's when the next pandemic is gonna come.
Right.
I don't think it's really anyone's fault that it got out. I do think China should have warned us about it beforehand and stopped trying to destroy the evidence of it.
Right.
But other than that, I really don't think it's anyone's fault.
Yeah, you're right. Thank you, Jillian, for joining in from United States. We have with us Marco from Rome, Italy, for the updates. Let's take a look at it.
So, okay, I'll try to begin talking about the beginning of the crisis. I think that even though Italy has a really good health system, we weren't prepared to face this kind of crisis, and I think that the government didn't know it was going to hit Italy so strong. So in the beginning, we heard a lot that it was an issue, but we just needed to wash our hands, try to not touch our eyes, our nose, our mouth, and everything was going to be okay. And then we started to have a lot of cases in the northern part of Italy, specifically in the region of Lombardia, and with capital is Milan. And Then after some days, the government decided to lock down Lombardia, then Emilia-Romagna and other regions around the Lombardia region. And then some days later, the government decided to just lock down our country and cancel classes and make people stay at home. So our life has changed quite a lot since the beginning of the lockdown, but it's manageable. We if we want to go out of home, we need to carry a form that we have to fill with our document residence from where we are going to where we are heading to. And for example, when we enter the supermarkets, it's just three people can enter the supermarket. We have to wear gloves, and we are trying a lot to obey the social distancing rules. But actually, I think, and I see from my friends, I mean, I hear from my friends because we cannot see each other personally because we can't go out. Like we have to stay at home. We just can talk by WhatsApp or any kind of social media, and you can go out of your house if you have like a valid reason, like to go to the supermarket to buy food, but you have to go to a supermarket close to your door, to your house, or go to the pharmacy. So I think one of the things that are really hitting the
Thank you, Marco, for joining in and giving us the update from Italy. We have with us Jason from Kingston, Jamaica, for the updates on coronavirus. Let's hear from Jason.
All right, so basically, here in Jamaica, we to date we have 38 cases of COVID-19 persons infected. It is a situation where, right, there are, to my knowledge, 3 deaths and 2 persons have recovered. 20 persons, 20 of the cases were imported. So, persons, Jamaicans who traveled abroad and came back and from countries that they were infected, mainly the USA, UK, and Europe, countries in Europe. So yeah, right now the Prime Minister of Jamaica has declared a state of disaster the entire country. So yeah, the Prime Minister has declared a state of disaster. So basically what that means right now, they can basically do anything. They can enter our homes without a warrant, really, if they suspect that persons within the household have COVID-19 or is infected with COVID-19. That's one. He did that, and then he did some restrictions where at first in the month of March it was a case where no more than 20 persons should be in a setting. So like churches and any gatherings, concerts, any form of gatherings, it should not exceed 20 persons. Then later on in the month, he reduced it to 10 persons. Um as the figures increased, he reduced it to 20 to 10 per to. Yeah, I forgot to note that, so as of the 23rd of March, no one can come to Jamaica. So our airports and our seaports are closed. So no inbound, no outbound, no flights, cruise ships can come to the country. And what I was saying earlier, effective the 1st of April this year, which is today, we now have a curfew. So it is a case where between the hours of 8 p.m. to 6 a.m., no one should be seen on the road. Yeah, fail to do so, you can be imprisonment or you can be fined. We also had a case where a lot of our retailers, supermarkets, they were price gouging. So they were doubling or even tripling the price of grocery items, especially with regards to you know um, cleaning items.
Thank you, Jason, for joining in from Jamaica. We are joined by Mark from Manila, Philippines, for the updates. Let's take a close look at it.
So here in the Philippines, we're tackling coronavirus. First, we measure. The government is trying to measure it. What's the impact of coronavirus in the lives of Filipinos? Especially here in the Philippines, we are in the third country. So we could not afford if the cases will blow out because it will overburden the healthcare here in the Philippines. So with the number of cases we have right now, like 3,000, the current status of the healthcare system is now overburdened. So just to countermeasure those repercussions that the coronavirus is trying to impact the lives of Filipinos. So government implemented this so-called absolute um, absolute lockdown quarantine. So quarantine is lockdown measures which people are not allowed to go out unless it is for buying of their essential goods or basic needs. So and then social distancing, they are implementing this also. Coronavirus is really that what I call that one. The effect of this pandemic is really traumatizing, especially to the marginalized population here in the Philippines because they cannot afford to go out. There are two kinds of views. There are views for the privileged one, and there are views for those who have heart for the poor population. So now my own sentiment is that as much as the government is trying to extend help to the marginalized population, there are also limitations on that. So the quarantine pass is being implemented here by local government unit. So it is cascaded down to barangay unit. So barangay unit is the smallest unit here in the Philippines, which is being managed by chairman. So it is the discretion of the barangay to implement it so that every household must have one quarantine pass. So only one representative is being allowed to go out to the grocery or to buy medicine. And there are also part here in the Philippines who implement curfew. So are not allowed to go out like from 8 p.m. of the evening until 5 a.m. of the early morning. But some parts of Manila, they implement 24-hour curfew. You are only allowed to deliver.
Speaking about the coronavirus cases in the nation, in India, we have Maharashtra at the top of the chart. Over 400 confirmed coronavirus cases has been reported alone in Maharashtra. Almost over 20 deaths has been recorded in Maharashtra alone. We have with us Shashikant Thakre from Maharashtra to give the updates on the COVID status back there in Maharashtra. Let's take a look at the reports.
The government took a step which was taken globally. There's nothing like the special thing that we took. And if this is the only precaution is only the cure for this disaster, then we can't help it out.
Is there essential commodities back there for you?
Yeah, there are. Like we do have all the shops open. The essential shops and the essential facilities are available till some point of time, and people are following social distancing methods in order to keep them safe. So if the services are also available, there are some precautions also taken care. It's not gonna vanish all of a sudden within few days. It is gonna take time to completely cut off from that virus, and the quarantine is the best process to follow for right now. And no one can really uh, put that in a time frame that how much time it is going to take place.
Thank you, Shashikant Thakre, for joining in from Mumbai, India. We have furthermore reports from Kerala, Delhi, Andhra Pradesh, Tamil Nadu, and quite recently from Pondicherry. There are two confirmed cases from Pondicherry. We are here with this Dr. Anjana, a practicing doctor from Kerala. Let's hear from the doctor.
So it occurs as an outbreak of pneumonic cases in December 2019 in Wuhan, China. So on further investigation of these pneumonia cases, the health workers found that it was caused by a previously unknown virus which is now named as COVID-19, that is 2019 novel coronavirus. So there are different types of coronaviruses. Some of the examples of such viruses are subacute respiratory syndrome coronavirus, Middle East respiratory syndrome coronaviruses, and now the COVID-19 coronaviruses. Okay, so this coronavirus mainly affect the respiratory system and also the gastrointestinal system. So respiratory system, the symptoms mainly produced by the patients are mainly fever, flu, cold, cough, pneumonia, such symptoms. Okay, and the GI symptoms mainly include diarrhea. The mortality rate of corona is yet unknown and have to be found out. Now let's talk about how it is transmitted. Transmission is mainly through droplet or by infected contaminated object by the infected person, or direct contact with the person. Mainly transmit from the person to the healthcare workers, family workers, and such way it goes along. So the chain goes away long. Okay. Now let's talk about how we can prevent the coronaviruses. Preventive measures just simple, just by improving the standard basic hygiene practices, which include basic hand washing. Regular and frequent hand washing helps in prevention by with soap, sanitizer, alcohol based scrubs is enough to prevent corona. Then we can use mask like N95 mask is, that is not necessary, but if it is good if it is there, but any mask can be used. Then you buy, the most important key is social distancing. Keep a distance because we don't know who are infected yet, because it has been a widespread now. So who are infected, who are not infected is yet unknown. So social distancing is the key. Now we can in healthcare workers like us, we use personal protective equipment like gloves, masks, even suits that helps in prevention of diseases from the patients we are treating into us.
In my motherland Kerala, as you can see, the roads are empty, most of the shops are shut down. Kerala reported 14 fresh corona cases, including one health worker for the first time. The total number of active patients in Kerala is over 200 cases. Six of the new cases are from Kasaragod district, the most infected district in Kerala. A total of 72,000 persons are under observation in Kerala. Out of them, only 466 is in hospitals. The rest are in their homes. By far, 4,500 samples were sent for testing, and around 3,300 of them returned as negative. Section 144 that prohibits mass gathering invoked in 5 districts and all other districts shut down borders. Public transportation is banned and shops shut down barring those provided essential services like groceries and medicines. However, the police has exercised force in some part of the Kerala to shut down non-essential shops that opened and lessened the crowd on the roads as people came out in large numbers. Kerala has also installed a pass system sort of self-declaration form which have been made mandatory for people who are not part of the essential services to venture out. All media persons is exempted. As you can see, as a part of the Break the Chain initiative, people come and wash their hands in this artificial installed hand washing system. To restrict the movement of people, the district administration of Kerala has ordered the petrol pumps to stop sale of petrol to all those vehicles except those who are on essential services. So the coronavirus cases has increasing day by day, and containing a virus is not just the responsibility of government but the citizens too. This means being socially and psychologically responsible, such as practicing good hygiene and not hoarding supplies unnecessarily. This is Nirmal Joy joining from Kerala on the status on Corona status on a global scale as a part of investigative report for Asian College of Journalism. Stay tuned for more updates. Stay safe. So keep the social distancing, and thank you for once again joining in.